I'm Becca Crane. I did my project on trisomy 18, mosaicism full and partial, also known as Edwards syndrome, more commonly known as Edwards syndrome. Trisomy 18 is a chromosomal condition caused by an error in meiotic division. It's identified by a third copy of chromosome 18. It's quite rare, occurring in only 1 out of 5,000 children. Most of the babies diagnosed with this condition are female. It's not only detrimental to the growth of the fetus pre-birth, but also nearly impossible to live with. Only about 50% of the babies brought to term will be born alive, and if they do make it to birth, they usually die within 2 weeks. There are 3 distinct types of trisomy 18. There's full, partial, and mosaic. The error in meiotic division is specifically a non-disjunction event during embryonic development. Slide. There's also like such a low chance of survival. It's really sad. The history. It was discovered in 1960 by the geneticist John Edwards. He discovered it a year after trisomy 21 was discovered, which is Down syndrome. And he actually discovered it by identifying trisomy in a newborn, but he didn't know what kind until after it died. He was able to test the cells and see that it was trisomy 18. It's really sad. So this is the karyotype sheet for trisomy 18. You can see that there's 3 chromosomes on the 18th chromosome. That's about it for that. So this is mosaic trisomy 18, which is like the center of my project. It occurs when there are 2 different cell lines existing in the same individual. The term mosaic typically describes something that is out of the ordinary or different from the original. This type of trisomy is given the term mosaic because only a portion of the cells will have the 3rd copy of chromosome 18. This occurs because of the non-disjunction event in embryonic development. Only a portion of the Q arm of the chromosome down here will attach or translocate to a different chromosome, and it will cause just some of the cells to have the 3rd copy. Most of the babies with this condition also die. Basically, all the babies die. It's terrible. Okay. Full Edwards syndrome occurs when all the cells in the body contain the 3rd copy of the 18th chromosome. This type of trisomy 18 is the most fatal among the 3, with only a limited number of children surviving to term. Partial trisomy 18 is the least common. It occurs in 1 in 100 cases. It's when only a portion of the Q arm is present in some cells. So like with mosaic, the Q arm is present in some cells, the whole Q arm. But with partial, only a portion of the Q arm is present. And depending on what portion of the Q arm is present, the survival increases or decreases. So the severity of the cases can change depending on what part is present. Some of the physical characteristics associated with trisomy 18. It can be identified by multiple characteristics. Some of the physical characteristics associated with it include a small, abnormally shaped head, overlapping fingers and locked hands, a low birth weight, and underdeveloped bodies. These characteristics can lessen the chance of survival after birth. Only a fraction of the babies that live through the pregnancy will survive, and these don't necessarily, like the flexed hands and the low birth weight, obviously those can contribute to a lower survival rate, but these are a lot less severe than the health conditions that come with trisomy. Health conditions associated with trisomy. My face is on the words. Okay. One of the most common health conditions associated with trisomy 18 is congenital heart defects. The most common heart defects are ventricular septal defect and patent ductus arteriosus. Ventricular septal defect is the most common among the trisomy 18 patients with heart defects. VSD is a heart condition where the lower chambers of the heart connect. The wall that separates them is non-existent. Although this condition can be treated through surgery, it increases the fatality rate among the children that already have trisomy 18. Patent ductus arteriosus is less common than VSD, but still prevalent in the correlation between trisomy 18 and congenital heart defects. It's where the ductus arteriosus, which is part of the heart, doesn't close, and it allows oxygenated blood to pass into the wrong chamber, leading back to the lungs. This condition can also be treated with surgery and certain medications to close the pathway, but it still poses a threat to the life of the child. These conditions are more life-threatening than some of the physical and mental disabilities that the children are born with. Physical and mental disabilities associated with trisomy 18. We talked about the physical with the low birth weight, abnormally shaped head, overlapping fingers. The severity of the mental and physical disabilities is more dependent on what type of trisomy you have. Clearly with full trisomy, it's almost guaranteed that you'll have most of these disabilities or delays, but it can change. With partial, you have the opportunity to live almost a normal life, depending on how severe the case is. The most common disability associated with trisomy 18 is developmental delays. Children born with trisomy 18 commonly experience slower development, not only with speech, but also cognitive and motor functions. These disabilities are not only limited to children with trisomy 18, obviously. Although most children born with these delays don't grow out of them, they can still be treated and improved. They can easily be worked on through the developmental stages of their life. They can use speech therapy, motor development therapy, physical therapy, and then training with social skills. Similar conditions. Trisomy 18 isn't the only condition with the third copy of the chromosome pair. The closest condition to trisomy 18 is trisomy 13, which is called Patau syndrome. And then the more well-known trisomy condition, which is trisomy 21, also known as Down syndrome. Patau syndrome is really similar to Edwards syndrome. The cause of this condition is the third copy of the chromosome 18. This is the most rare of the trisomy conditions, occurring in less than 20,000 babies a year. Like Edwards syndrome, it's also caused by an error in meiotic division. It's similar to trisomy 18 with the life expectancy, severity of the condition, and the disabilities that come along with it. Most babies with Patau syndrome will die during pregnancy or within a few weeks of life, which is just so sad. Trisomy 21 is clearly more well-known than both of them. It's the most common, occurring in 1 in 700 babies. This is where the third copy of chromosome 21 is present. It's the least fatal of the trisomy conditions, presenting small fatality rates among the other conditions. Yeah. Like trisomy 18, Down syndrome has a few different variations. These variations include full Down syndrome, translocation Down syndrome, and mosaic Down syndrome. The mosaic part is the same as trisomy 18. It's just when a portion of the cells contain the third copy. Full Down syndrome is the most common of the three types of Down syndrome. It occurs in 95% of the babies with this condition. And then translocation and mosaic make up the other 5%. Advancements and progress. As of right now, there's no cure for trisomy 18. There's no way to reverse the errors in meiotic division. Currently, though, research is being done to better understand the errors in cell division, the effect it has on the development of the fetus, and the direct influence it has on the life expectancy. Although there is no cure for trisomy 18 at this time, there is treatment and therapy for children that do survive with it, especially for children that only have partial trisomy 18 and have the opportunity to live a more normal life. The most common, trisomy 21, the most common trisomy should be used to better understand the effects of meiotic division and the effect on life expectancy. I know that trisomy 13 is being researched right alongside trisomy 18 because of the similar effects it has on life expectancy, and it has the same understanding. Like, it's just a confusing condition that there's not a lot of understanding on. Go to the next slide. Conclusion. So as we know, there's limited understanding of this condition, a low survival rate, no cure, and research being conducted now. Hopefully a treatment becomes available to either reverse the effects of the error in meiotic division or to increase the survival rate of the babies that do have it. That's about it. These are my references. All right. I'll stop sharing. Thank you.